Hi, I'm just waiting at Dublin Airport. Storm Garrett is about to hit and a lot of flights are delayed. So I thought I would do a quick video on some more aesthetic medicine trends that I would like to see finish off completely in 2023 and not continue into next year. The first of these is this fox eye thread lift. I'm not a fan of threads at all, and I'll explain why in a longer video, but particularly the fox eye look I think is inelegant. It doesn't last, it's not very safe, it can snag nerves and blood vessels, it doesn't look good, and I think it's really a poor trend. Another is buccal fat removal, where a surgeon will go inside the mouth with local anaesthetic, make a nick and take out this lovely little nugget of fat here called the buccal fat pad. And this is to give a contour, but these are often done on young, beautiful women who really don't need any procedures. And I think they can achieve really good contour with just makeup. They're often experts at makeup. When I see more mature women, I think we are seeing a lot of changes in the skin, but also in the fat pads. And the nasolabial fat pad here, like the superficial fat pads, they slide down with age and they can be heavy, especially at the bottom here. So if you combine heaviness with a hollow look here, it doesn't look good. The deep fat pads, which are attached to bone or stuck to bone, shrink back. And so as we get older and older, we need some fat on our face. It looks youthful. Think of lovely chubby kids with lovely cheeks. And so I think taking out that buccal fat pad is not a good idea. It doesn't regenerate. Once it's gone, it's gone. And as well as that, I see older, more mature women, and they're often missing a tooth on one side or the other. And that accelerates the bone loss, because if you don't have dental support, the bone is not staying as strong as it should do. So I think taking out buccal fat is not a good idea for me. The other is not having harmony in your face. And many people just focus on 3 areas of Botox. So forehead lines, frown lines, and crow's feet lines. And what can happen then is sometimes if they're asking for a frozen look, this is overtoxed. The face may be overfilled in the mid face with too much filler, giving a pillow face, and then the lower face is sagging. And there's just a disjoint between the thirds of the face, and it jars, it doesn't look right without knowing exactly why. So I think too much toxin is not a good trend. Too much filler, especially in the mid face, is not a good trend. And then not addressing a sagging lower face creates a break in harmony between all parts of the face. Another trend I see is where people come into me looking for injectables and they really don't have a good basic skincare routine. They're not using SPF every day, they're not using retinol or vitamin A products, or they're stopping them and starting them and taking a break in the summer, and they're not using vitamin C antioxidant serums. So I think one of the simplest things you can do, which is the lower hanging fruit, is establish a good skincare routine. The products don't have to be expensive, but my top 3 ingredients, number 1 is always going to be a good quality SPF covering both ultraviolet A and B rays, and that needs to be a factor of 30 at least. Don't rely on the SPF in foundation or tinted moisturizer. We don't put on enough to get adequate coverage. So a separate SPF product year round, every single day, whether it's cloudy or cold, as long as there's daylight there, those ultraviolet rays can affect the skin. And they cause premature aging, age spots or sunspots, and they predispose to skin cancer and also wrinkles. So SPF, vital. Number 2 is retinol or vitamin A products, and these help build collagen. They don't thin the skin, they strengthen it, they reduce pigmentation, and they can safely be used year round. And they're ideally a nighttime product, and they're not recommended in pregnancy or breastfeeding. Vitamin C is often overlooked. We need an adequate amount in our diet, but when you put it on the skin, it acts as an antioxidant. It helps build collagen and it helps to brighten the skin, and it works really well with SPF and vitamin A. So I think those are trends that we would love to see just finish off. So I think it's the common things are common. Have a good skincare routine. Try not to get frozen if you're having botulinum toxin. Try not to get overfilled if you're having dermal filler, and then watch out for trends. Trends come and go, but elegance and beauty and proportion and safety are priorities. when I see new trends, I always just sit back, I look at who's doing them, do I respect the practitioners doing them, what's the clinical evidence behind them, what sort of safety track record do they have, where is it made, and where can I find out more. And I don't jump in at the deep end with new trends, because I think you can achieve so much with just good skincare and very gentle, subtle injectables or other skin treatments. And trends, I just sit back and wait and watch. Some of them just bite the dust, and others, if they're really good quality, may endure. And there's no rush. It's a marathon, not a sprint. Take care, and hope you all have a lovely new year. Bye bye.